my YouTube channel. First, I want to introduce myself. My name is Adi Kurnia. I'm from STEI Indonesia. And then, in order to the task of business communication, I'm here to discuss about COVID-19 is happening around the world. And now, during a pandemic, we need to know what the COVID-19 is. The COVID-19 is deadly respiratory inflammation virus from Wuhan, China. After this, many countries also confirm this virus. For the example, German, Japanese, Singapore, Italy, USA, Korea, and France. And then, special for my country, Indonesia, this situation for many people, there is so hard. The first case was happening at Indonesia in March 2020 at Depok City. So with that, we can prevent COVID-19 transmission by washing hands, keeping distancing, and wearing masks. In Indonesia, government make some rules, and then one of the rules of Indonesian people we can call lockdown. Lockdown is a situation that prohibited residents from entering a place due to an emergency. Lockdown can also mean a country that closes its borders, so that no one enters or leaves the country. There is another with the term full lockdown. In this situation, people must really live in the homes of people whose area applies full lockdown policy. They are not allowed to move outside at all. However, exceptions are allowed only for a few things that are permitted by the local government. In the next situation, there is a lockdown effect for any people. In theory, it is true that lockdowns can help reduce the risk of disease transmission effectively, including in terms of transmission of the coronavirus. You see, the lockdown causes people to be unable to move freely as before. Especially the effect on people who live in areas that implement this lockdown policy. One of them is the psychological impact, such as feeling of fear, anxiety, and isolation from the surrounding environment. If not treated properly, the condition can develop and lead to mental health problems. When it is a situation to stay at home and do many activities outside the home to prevent transmission of the COVID-19 virus. On the other side, government make new rules, namely is PSBB, PPKM, Mikro PPKM, etc. After this, many people of Indonesia feel sad because they can work as usual, and many have lost their job because COVID-19 and unable to meet the needs of daily life. The government makes one rules again to help the others. There is a social assistance we call in bahasa is bansos. The list is sardine, rice, any oil, instant noodle, soap, sugar, and there are also snacks. In December 2020, when the case COVID increased to month, we have one tragedy. There is about corruption, social assistance by social minister. There is we heard when the condition is so bad, government doing like this, it's make we cry when I hear that. And then in my solution about this situation, we consider lockdown is the best solution to make sure there are no spreading activities. And the other side, we have instruction no activities involving gathering in some area. We realize that gathering is the fastest way for the COVID-19 to spread. We need to do the health protocol. Stay in the sun in the morning, always wear masks, and wash your hand more often when you have to go outside. I will end my speech by reminding everyone again that the government has done so many things during this difficult time. So please follow the rules and regulation that we made. And then we back to the topic of pandemic COVID-19 situation. There is for the example of preventing the spread of COVID-19, that is, the first, wash your hand with soap. Second, use mask and face shield when leaving the home. Third, always apply social distancing while you are in public place. Fourth, don't hang out in public place if there is no urgency of doing so. We can fight this virus by keeping ourselves healthy and others safe. I hope this pandemic can end soon. While waiting, let's not do anything that can make it worse. Let's pay attention to social distancing. I know everyone miss going out and meeting friends. However, by staying home, we minimize the chance of spreading the dangerous virus. And finally, in this my video, I want to say our Indonesian people to continue to comply with healthy protocols and use masks when doing activities outside the home. Thank you so much for listening, my friend. I'm so sorry for my mistake. You all the best. Stay safety and be careful. Goodbye.
Coronavirus is a word people are talking about a lot lately. The coronavirus is a kind of germ that is making people sick all over the world. This kind of coronavirus is a new germ, and we are still learning about it. Maybe you've had to stay home from school before, or missed a basketball game or dance recital when you didn't feel well. Part of the reason you stay home when you're sick is to feel better, and the other part is that when you're sick you can be contagious, which means your germs can spread to someone else and get them sick. One thing we do know about the coronavirus is that it is very contagious. When someone gets sick from it, they can spread it to other people through coughing, sneezing, touching hands, and even talking too closely. For some people, the virus makes them feel only a little bit sick, like they have a small cold. For other people, the virus makes them feel very sick. When they do get very sick, they get a fever, a bad cough, and can have trouble breathing. Someone who gets the virus can pass their germs to other people, even if they don't feel very sick. That's why we all need to work together to make sure the coronavirus doesn't make more people sick. Some of the things we can all do are things that you do at home and school all the time. Wash your hands often with soap and water. Cover your cough and sneeze into your elbow. Some of the things we are all doing together are new things, like staying home from school, not playing with our friends, not going to playgrounds or sports practices. You might have heard people call the way we're acting social distancing. Everyone has added some extra distance to their personal space to stop germs from spreading between us. It is not easy to stay apart from our friends and family members who live outside our own homes, but we can stay connected through phone calls, video chats, and even by mailing cards, letters, and drawings. When the germs do spread around, we have doctors and nurses working to help people feel better. You might be scared or confused about everything that is happening, and that's okay. But there are lots of people trying hard every day to make things better. We can live outside our own homes, but we can stay connected through phone calls, video chats, and even by mailing cards, letters, and drawings. When the germs do spread around, we have doctors and nurses working to help people feel better. You might be scared or confused about everything that is happening, and that's okay. But there are lots of people trying hard every day to make things better. You can be a helper too. Wash your hands a lot. Be patient with the adults around you. Wear a mask when you're out of the house and around people. And encourage your friends to learn about coronavirus. Thanks for watching and stay safe.